My name is Joanne Joy, and I'm currently a consultant on the LGBTQ plus public health projects with Healthy Communities. I, however, was the original director of Healthy Communities and was the first employee of the organization. So I've worked in tobacco prevention for a little over 20 years. And I myself am a lesbian and was a smoker. And most of my peers were smokers a long time ago. So I knew that addressing substances and LGBT needs was a huge need, because we have LGBT kids spending their money on this addiction, spending their youth using nicotine instead of developing strategies to cope with their life. And it's a real barrier to growing up healthy.
So my name is April Hughes, and I'm the Associate Program Manager at Healthy Communities of the Capital Area. The LGBTQ plus Youth Tobacco Prevention Project started in 2021 through the Center for Tobacco Independence at Maine Health. We worked with one of our partners out Maine. They're the only statewide organization that works only with LGBTQ plus youth. And we worked with an advisory council that was made up of representatives from schools, youth serving organizations, community-based organizations, prevention professionals, behavioral health organizations. What we did was conduct a needs assessment, which looked at completing a cross-analysis of data from the 2019 Maine Integrated Youth Health Survey data. Part of that needs assessment was also doing a comprehensive literature review.
I think part of me knew there would be no research that actually involved LGBT youth voice. But when we looked at research in every English-speaking country in the world, and there was none, I was shocked by that.
We really needed to have input or thoughts and experiences from LGBTQ plus youth themselves to really understand from their point of view the impact of tobacco use amongst their peers and different strategies to address it.
We actually went to GSTA's, Gay, Straight, Trans Alliances, and said, are there youth in your existing group that we can meet with? We have learned that trying to get youth to come to us, it never works. It just never works. But if we can go to them with precise time, questions, responses, what do we need, then we have good feedback. They're in an environment they're comfortable. They can build off each other and respond to us.
So we did complete that in March and April of 2022. So what we were able to do is take the information that we learned from the needs assessment and the focus groups and surveys with the young LGBTQ plus individuals themselves and really identify the current gaps.
That primary recommendations are reduce minority stress first. Everyone needs to know that no prevention will work unless you're dealing with the kids' minority stress and building resilience. All the research shows that the more craziness in a person's life, the less able they are to care about not smoking. The needs assessment said, educate adults. Tailor materials to LGBT kids with their input. We have asked LGBT kids about the materials that other people have made, and they just go, really, get rid of that. The number one predictor of whether a person will use tobacco is how many in their peer group use tobacco. So just treating tobacco will improve their chances of other kids' chances of not starting.
What's exciting for us is that we are able to take this information and then identify other opportunities to actually implement these recommendations to support our young people.
And then because we had the needs assessment and recommendations, it was easy to then, when you find a funder, say here's what we've done, here's what we've done, here's what we've done, here's the evidence, here's the evidence, here's the evidence, here's the program, and this is why it fits your money.
What we ended up doing was identifying other additional funding sources to really enhance our tobacco prevention efforts within our local communities. We ended up identifying a grant through the Maine Cancer Foundation to support developing LGBTQ plus youth-specific tobacco treatment. The other piece is we recently were awarded a grant through United Way of Kennebec Valley to enhance current youth programming in schools, youth-serving organizations, and after-school programs to make them more inclusive to LGBTQ plus youth.
So I don't really expect a change in the data for 5 years. I can't say that. But walking down Water Street in Augusta and seeing the mural and knowing the football captain helped with that he's an ally and he's helping. Those things are the successes, because that's what'll make the big difference.
Our mission statement for our organization at Healthy Communities of the Capital Area is to convene and support people, organizations, and communities to collaborate on public health. What was exciting about the LGBTQ plus youth tobacco prevention project is that we continued to do that. Behavioral health organizations, we worked with schools, youth serving organizations, LGBTQ plus youth themselves, and we included all of these different voices on this project so we could have a full comprehensive look at that specific issue. Because if you're only doing public health through one lens, then you're going to miss communities of people.
These focus groups and surveys really are good science as well as good information from the kids. And I think people need to know that. When they go to our website, at HCCA's website, and look at the results, they need to know that this is really evidence-based and this research is something they can hang their hats on and they can use. Even though it was 3 counties in Maine, they can use this data for their own projects.
Not only is HCCA, Healthy Communities of the Capital Area, using it or utilizing it in their programming and planning and identifying different funding sources, but we're hopeful that other organizations across the state or even beyond the state of Maine could also use that information to make sure that they are developing tobacco prevention strategies and even other public health strategies that are tailored to LGBTQ plus youth.
Kids don't know they're included unless you show them they're included. The number one success for me is that I could leave my job and know they would take it. That there were straight allies that would prioritize queer kids.